Welcome to the channel. In this video, we will explore the radiological anatomy of the external ear, detailing its components, characteristics, and anatomical relationships from an imaging perspective. The external ear consists of two distinct parts, both anatomically and functionally: the auricle, also known as the pinna, and the external auditory canal. The auricle captures, concentrates, and amplifies sound waves, channeling them into the external auditory canal, which transmits these sound waves as vibrations to the tympanic membrane. The auricle is composed of elastic cartilage covered by thin, hairy skin on both its anterior and posterior surfaces. At its lower part lies the earlobe, a region without cartilage, composed of skin, fibrous tissue, fat, and small blood vessels. The external auditory canal is divided into two sections, the lateral 1/3 and the medial 2/3. The lateral third is the fibrocartilaginous portion, continuous with the auricle, lined with skin and containing hair follicles, sebaceous glands, and ceruminous glands that produce earwax. The medial 2/3 form the bony canal, lined with very thin skin that adheres tightly to the underlying periosteum and continues with the outer layer of the tympanic membrane. This segment is bordered medially by the tympanic annulus and the scutum. The tympanic annulus is a shallow bony ridge where the tympanic membrane attaches inferiorly, while the scutum, a sharp bony spur, extends from the medial roof of canal, marking the junction between the canal's roof and the lateral wall of the middle ear cavity. Superiorly, the tympanic membrane attaches to the scutum. In adults, the external auditory canal measures approximately 2.5 centimeters in length, with the cartilaginous portion oriented postero-superiorly and the bony portion oriented antero-inferiorly. In infants, the canal is predominantly cartilaginous. The narrowest part, called the isthmus, separates the cartilaginous and bony portions. The anterior, inferior, and lower posterior walls of the bony canal are formed by the tympanic portion of the temporal bone, while the posterior wall and roof originate from the squamous portion. The anterior wall also serves as the posterior wall of the temporomandibular joint, and the posterior wall forms the anterior boundary of the mastoid segment of the temporal bone. Santorini's fissures are natural openings in the cartilaginous portion of the external auditory canal. Although small and undetectable in imaging, these fissures can act as pathways for the spread of infections or neoplastic processes between the parotid space, temporomandibular joint, and the external auditory canal. The tympanic foramen, also known as the foramen of Huschke, is an anatomical variation in the tympanic portion of the temporal bone. This foramen, located in the antero-inferior aspect of the external auditory canal, persists as a permanent defect only if it remains open after 5 years of age. The tympanosquamous fissure separates the tympanic portion of the temporal bone from the squamous portion and is located parallel and anterior to the bony canal. The petrotympanic fissure, or Glazerian fissure, provides a pathway for the chorda tympani to exit the middle ear and enter the infratemporal fossa, along with the anterior tympanic artery. The tympanomastoid fissure, when open, separates the tympanic portion of the external auditory canal from the mastoid portion. Through this fissure emerges the auricular branch of the vagus nerve, also known as Arnold's nerve. The external auditory canal has key anatomical relationships. Anteriorly, it is related to the tympanosquamous and petrotympanic fissures, as well as the temporomandibular joint. Posteriorly, it is bordered by the mastoid air cells. Superiorly, it relates to the superolateral mastoid air cells. Inferiorly, to the parotid space, and medially, to the middle ear cavity. Thank you for joining us on this journey through the radiological anatomy of the external ear. If you found this information useful, we invite you to subscribe to the channel, leave a comment with your thoughts or questions, and give this video a like. See you in the next episode.